Now that you've torn your ACL, there's a big decision that you have to make, and that's what type of graft you want to use in order to reconstruct that ACL. We've talked previously about what are called autografts, or using your own tissue, but today we'd like to talk about what's called an allograft, or using a cadaver tissue in order to reconstruct your ACL. There are several advantages and disadvantages of using an allograft. The first disadvantage is that you might reject it. Since it is someone else's tissue, there's a very small chance, about 1 in 10,000, that you might reject this graft. There's another disadvantage, is that it's not typically used in individuals that are less than 40 years old. That's because it just doesn't allow patients to return to contact sports as easily as some of the other tissues because it's not your own. However, there is a big advantage of the allograft, is that we don't have to take your own tendon, so that there's not the requisite weakness from either taking your hamstrings or your quadriceps or your patellar tendon autograft. Please talk to your doctor about which is right for you, but in individuals that are over 40 years old, this is when we typically recommend using a cadaver or an allograft.